If I were to talk to any clinician who's just adopted remote care, I would advise them, if they're worried, maybe start with a few patients, practice with it, and then get their feedback. You can try using different timelines. You can try different tasks that you can give a patient, and then ask for feedback from them. So then when you're showing other patients that this is something you're going to add to your clinic protocols, you can give them real feedback from your own patients in your clinic. Patients are very happy to volunteer for these things, so I would give that a shot.
When we were trying Remote Assist, one of my coworkers was a little bit hesitant. Even though she saw how easy it was and how quick it was, it just wasn't something she felt quite ready for. So I gave her a little bit of a hard time about it. And after she did try it, she said, "Oh my gosh, Sandy, why didn't I try that weeks ago? It was so easy and my patient is doing so well."
Most of my patients feel very positive about remote care. It hasn't negatively impacted my patient relationships. In fact, I would say that a lot of them feel that I'm quite quickly or easily available if they get personalised responses from me in, response to a question or a comment, for example, during remote check. Most people feel that it is an addition to what we're doing anyway, so they feel even more supported in a additional way.
So definitely when introducing something new, getting everyone on board can be a bit of a challenge. So I think not everyone could see the benefit or understood how it was going to help the clinic or how it helped their service and could see the big picture. So definitely getting everyone on board, explaining how it works, what the vision was for the clinic, what we envisioned the future state to be, even though we weren't there yet, and getting them to just trial it and have the patience as we learned. We knew we would make mistakes along the way, and that there was that trial and error.
It was really important for us to identify a clinic champion, someone who from the start really believed in the telemedicine tool and in remote care. And that's exactly what we did at our clinic, because we needed to be able to operationally protocolize how we would use this tool. And there was an audiologist on our staff who was willing to consider, how are we going to marry this into our billing practices? Where will we integrate this for report writing and the EMR? How will we even have talk tracks from the patient care coordinator that answers the phone to aftercare, even our other Cochlear colleagues? So we wanted to be certain that we were addressing every aspect of how this would get married or incorporated into the clinic, and having a clinic champion just made an appreciable difference.
So over the last 12 months, we've definitely seen an increase in the level of use of our remote care services. And I think there's the clinicians and the admin team becoming more familiar with it, it's just normal part of clinical practice now. And then the recipients as well, they know it's on offer. They're not, telehealth isn't a new thing to them. And so they're willing to give it a go. But we're also seeing a lot more of the repeat remote checks and things coming through. So those people who initially gave it a go, it's oh, actually I really like this. So now they're just doing their annual reviews. So we've got a lot more just in that review cycle now coming through with the remote check, and having implemented remote assist in the acute phase, we're starting to see that pick up a lot more.
I would suggest having discussions with your team about who you want to target, how you want to roll out remote care, how you want to approach whether you charge for remote care, and your clinical protocol on the front end. We were learning as we went, since we started this process pre-pandemic, when there wasn't a lot of virtual care knowledge for audiologists out there. So we found as questions came up, we had to circle back with our team a lot and address them and then move on with another meeting. I think if we had talked about those things on the front end, then we would have gone from a lot of meetings to a few meetings.
When I think about when I first started implementing remote care, it was new to me, and sometimes I'm a little nervous about new things, but it worked so well that I wish I'd been a little more aggressive with it with more patients. Now, at every activation, I advise my patients, this is going to be part of our remote care. I'm going to activate, I'm going to check on you again, and maybe one more time, and then after that, we're going to use remote check. And if you're having any difficulties, just let me know. I can send out a remote check and see, what do we need to do? Is there a problem? So it's been a real time saver for us, and it's been a great implementation to our continued care for our patients.